So in this video, I'm going to give you a few quick insights into what it might be that's causing pain going down your leg. Now, this could be a number of things. Sometimes people attribute it wrongly to actually a leg problem, and other times it actually is a leg problem. So with these few simple assessment points, we can really start to understand, is it something called sciatica, where it's essentially coming from your lower back? Is it a different variation of sciatica, essentially the same thing, but a different nerve coming from the lower back? Or is it actually you've injured your hamstring, or you've injured your calf, or you've injured your knee or hip, etc.? So the number one thing with these sorts of problems is understanding what would affect a nerve pain, i.e. the sciatica type pain going down your leg, and what would be an actual leg problem. So let's just suppose that you have symptom in the thigh area here, and this could be coming around to the glutes, it could be on the front of the leg, but nothing overtly in the lower back. Now, if we for a moment keep that nice natural curve, and this is your lower back here, that nice natural curve in our lower back, say we're sat down or standing up, for example, or even lying down, but keep this spine dead still, and we start moving this leg here, maybe extending the knee, kicking the leg out, just moving the hip only without moving the back as well. We can start to understand if we stress these muscles on the front, does it cause the pain to be replicated? Or if we bend the knee without moving the back, and these muscles on the back here tighten up, does that cause pain in the hamstring itself? If the answer is yes, then there's a good chance you actually have a local problem in that tissue, i.e. the thigh on the front or the back. The one classic mistake that you want to watch out for when doing these sorts of tests is that when you actually straighten your leg, for example, because you're getting pain down the back of the thigh, maybe into the calf, you go and move the leg and go, oh, it's a leg pain because it hurts in my leg. But actually, when you move that hip up to straighten that leg out, you actually pull the lumbar spine around, squash this disc, which creates inflammation on these little nerves here, which will send the pain down the leg. So you're basically testing in an inaccurate way and leading yourself to believe it's actually a leg problem when actually it's coming from the lumbar spine. Other tests to actually confirm that it is or isn't a lower back problem is movements, simple weight-bearing movements. Does it hurt when you go from a seated to a standing posture? Does it hurt when you sit down? Does it hurt when you go from lying down to standing up? And does it hurt when you move your back around in different directions, left, right, forwards or backwards, or even just slouching like so, or sitting up straight? Do those sorts of movements of the lumbar spine give you that pain in the leg? Or is it purely movements of that leg, i.e. kicking your leg out, as I mentioned earlier, that gives you the pain in the leg? These are very, very simple do-it-yourself tests that give you a better idea of where the actual pain is coming from. And then, obviously, if you've seen any of our other videos, you know our advice on actually seeking help. If it's been going on for a couple of weeks, or really longer than sort of 10 days without getting better, then go and see your local osteopath, see your chiropractor, because they will be able to more accurately continue with more sophisticated testing, possibly do some imaging if necessary to get to the root cause of the problem. But quite commonly, especially if it's come on for no reason, it's going to be coming from your lower back. It's very, very rare that someone injures their lower limb without knowing about it. For example, like an ankle sprain, you know you've been over on your ankle and you've injured your ankle. It's fairly easy to distinguish from. So I hope that video has been helpful. It's been reasonably vague, but I hope there's a few points in there that are, or a few concepts that actually are helpful in you distinguishing whether your leg pain is coming from your leg or actually your lower back. And if you've got any questions, do leave them in the comments below. Thanks for watching. Thanks for taking time to watch our video today. Remember, for more videos like this, you can hit one of the buttons up here. For videos on our Back in Shape program, so you can work out from home and protect your back, just click the button over here. And remember to stay up to date with all our videos, hit the subscribe button above my head. Thanks for watching.